हेलो फ्रेंड्स, हिस्टोलॉजी के फर्स्ट लेक्चर में आप सबका स्वागत है। आज के इस वीडियो में हम डिस्कस करेंगे हेमाटोक्सिलिन एंड इयोसिन स्टैनिंग व्हिच इज वाइडली यूज्ड इन द हिस्टोपैथोलॉजी एंड साइटोपैथोलॉजी laboratory. Dash, these are the substances either acidic or basic or neutral is used for the color achieving and interlinking between the tissue and the stain. Dyes are of two types, that is first is natural dye and second is synthetic dye. Under natural dye there are hematoxylin, safranin and litmus. And modern are the substances that either acidic or basic that binds the tissue protein to provide the stain. Examples are aluminum or potassium sulfate that uses the basic modern. Then second is mercuric oxide used as oxidation or provide the oxygen. In the hematoxylin and eosin staining, hematoxylin is a basic dye that stains the acidic part. The nucleus is acidic, so it stains the nucleus. Eosin is a acidic dye which stains the basic part, that means cytoplasm. Then hematoxylin preparation. Hematoxylin is a natural product extracted from the hardwood of the logwood tree, Hematoxylum capsinum. For the preparation of hematoxylin, we have to need hematoxylin powder 2 gram, ethanol 20 ml, potassium sulfate 40 gram, mercuric oxide 1 gram, distilled water 400 ml. Procedure involved: add hematoxylin powder in ethanol solution and heat it in water bath till it dissolves. Name its solution A. Then potassium or ammonium alum heated in the water bath till it dissolves and name the solution B. For the solution A in solution B. Lastly, add the mercuric oxide and keep the solution in dark room. Then after 24 hours, filter and use it. Then eosin preparation. Eosin is made up of bromide, that is acidic moderate, and fluorescein that provides the color. For the stock solution, we have to use the 1 gram eosin in 100 ml distilled water. For the working solution, we have to use 500 ml of 70% alcohol and 1 gram eosin. H&E staining procedure, that means hematoxylin and eosin staining. Following steps used for the staining: at first the deparaffination, then second is dehydration, then primary stain, differentiation, bluing, dehydration, counter stain, again dehydration, then clearing, then mountain with DPX. The first process is deparaffination. For the deparaffination, the section cutting slide at first place on the hot plate for the remove the extra paraffin. Then dip in xylene for 5 minutes for remove the extra paraffin. We know that the xylene is a clearing agent, so for the further clearing the paraffin, extra paraffin, we have to dip in the xylene for the 5 minutes. Dehydration means removal of water from the tissue. 90% alcohol containing coupling jar, we have to dip 1 to 2 minutes. Then second, 70% alcohol containing coupling jar, we have to dip 1 to 2 minutes. 50% alcohol containing jar, we have to dip 1 to 2 minutes. Then primary stain, that means hematoxylin, 10 to 15 minutes. Hematoxylin stains the nucleus. Then tap water 1 to 2 minutes. Then the process is differentiation, that means 1% acid alcohol or HCl, 1 dip. Bluing, immediately running tap water 2 to 5 minutes. Then the process is dehydration. For dehydration process, 70% alcohol 1 to 2 minutes and 90% alcohol in 1 to 2 minutes. Then the counter stain, that means stains the cytoplasm. The using we have to dip 1 to 2 minutes. Then dehydration, absolute alcohol 1 to 2 minutes. Again absolute alcohol 1 to 2 minutes. Then for the clearing, xylene 5 to 10 minutes, and again xylene 5 to 10 minutes. Dry the tissue section and mounting with the DPX mount. Then mounting. Mounting is a solution that prevents or protects the tissue from physically, chemically, and fungally, and flow between slide and cover slip. It would the refractive index closer to the glass slide, that means 1.5. It will allow to visible clearly in the microscope. Examples are Canada balsam, Damer balsam, glycerin, DPX. The most commonly mounting medium is used is DPX. Full form is dibutyl phthalate polystyrene xylene. After the hematoxylin and eosin staining, whipped around for dry and put 1 drop DPX on the cover slip and gently place on the stained tissue on the slide and examine under the microscope. For the pathological studies, the nucleus appears blue due to the hematoxylin, which is blue in color, which is act as primary stain. Then the second is cytoplasm. It is appears as the pink color, which is stained by the eosin, which is counter stain. Here we complete the histopathology whole section. If you new in this channel, please do like, share and subscribe. Press the bell icon for the latest updates. Thank you.